qualified for this to seek it if they're in the position of doing that. Now, we have in Florida vaccinated close to 4 million senior citizens. You have over 70% of people who are over 18 have been vaccinated, and we work very hard. In fact, I remember when we first got the vaccines, the pharmacies weren't necessarily ready to do the nursing homes, so we did strike teams with Florida DEM, and we go through and do all of that, and we're very proud of that. What we've seen this summer, as we've seen the summer wave is, and I think in South Florida this is absolutely true as well, the percentage of people who are being hospitalized that are COVID positive are overwhelmingly people that have not been vaccinated, and even more overwhelmingly are people that have not, once infected, got the monoclonal antibody treatment. And so we think the data is that your chance of being severely ill is greatly reduced if you have been vaccinated. But on the back end, if you do get infected, whether you're vaccinated or not, clinical data and real-world data shows that if you avail yourselves of a monoclonal antibody treatment at the appropriate time, you will reduce your chance of being hospitalized by about 70%. And I would say throughout the state of Florida, at least 90% of everyone that's admitted to hospitals for COVID did not get the monoclonal antibody treatment prior to being admitted. And that's important to note because once you're sick enough to where you're going to be admitted, the antibody at that point is not able to counteract the virus. When you initially become symptomatic, if you go in and get it prior to the need for hospitalization, the track record is very, very good at resolving the symptoms. And so this has been available. The hospitals have been doing it the whole time. But I think what we have learned over the past few weeks is there's not enough people that know about it. Yes, if you go and you're talking to a physician, the physician very well may recommend this, but there are a lot of people showing up to the hospital that didn't even know that this was something that was possible. And so we did in Jacksonville, Orlando, Merritt Island. We're here in Broward. We're going to do a site that's going to open later this week in Miami-Dade. I'm going to be in Palm Beach later today. We're going to be doing some in other parts of Florida. But basically, we're going to have 10 to 15 sites throughout how many are we going to think you're going to have total? Oh, actually between 15 and 20. So between 15 and 20 sites that will do over 300, up to 300 treatments a day for patients. And so the goal is, look, we have vaccinated people that are getting infected. I think there's the breakthrough cases, they're not rare. Now, fortunately, they're almost always very mild. And so I do think, even though it's not providing sterilizing immunity to infection, it is providing a reduction in symptoms. Nevertheless, people that are very at risk, even if you're vaccinated, this treatment is available for you, and it's kind of like, the vaccine is preventative, and then this monoclonal is ameliorative on the back end to try to help reduce the severity, and it's done a very good job of doing that. And so the goal is obviously it'd be great to say no one will get infected, but we know even vaccinated people are testing positive. So once that happens, the goal is to get people to just have a swift recovery without needing to go into the hospital. And obviously, if you're reducing hospitalizations and hospital admissions, you're going to obviously be saving lives as well. So reducing the number of people that need to be admitted to the hospital, the more people that avail themselves of this treatment, you will absolutely reduce the number of people who are doing this. So this is going to be 7 days a week. There's a standing order in place by the Surgeon General that if you qualify, you can come. You don't even necessarily need a prescription because of that standing order. So who are the people that are most at risk? Elderly, immunocompromised, morbid obesity, living with diabetes, kidney problems, and then heart and lung conditions. And so if you're in that group and you do end up developing a COVID infection, if you do this early on in that stage before it becomes very severe, you have a great opportunity to have this result. You know, we're already having people write into our offices telling us, like, look, we didn't know about this. You know, my dad is vaccinated, but he got this. He started developing symptoms. We went in, and now he feels great 24, 48 hours later. And I think you talk to a lot of people throughout Florida that have done this. There's a lot of positive response. And so we're expanding access, but we're also raising the visibility of this because this is not something that the average person knows. I've actually known people that are in relatively high political office who got infected, and they didn't know that there were monoclonal antibodies. And so it's just, you know, you think about that and you're like, wow, this should have been something that we would have known. It's important to point out because there's so much nonsense that gets put out there. There's a lot of misinformation put out, unfortunately, you know, by a lot of corporate press. This treatment for patients is free. You come in and you get it. Do not let anyone tell you that you're going to be charged thousands of dollars. That is a lie. That is a lie that is being disseminated for political purposes to try to dissuade people from seeking life-saving treatment. And honestly, that's reprehensible. This whole Regeneron was purchased outright by the federal government in 2020. They bought the whole stock, lock, stock, and barrel. So whatever Florida is bringing down, the state of Florida is not paying anything for, and then whatever a patient gets, the patient is not paying anything. And so please do not be dissuaded thinking that they're going to charge you $2,000 or $1,500 or whatever. That is complete garbage, and I hope people are very clear on that going forward. So we this is going to be 7 days a week. We think that that's important for everybody, and this is one of the tools in the toolbox. It's been an underutilized tool. Many of the health systems have been doing a great job, but I think the public awareness has been lagging. We're doing a good job. I think more people are now asking about it, and now you're going to have in most of the major communities throughout Florida, you know, hopefully by the end of the week, you're going to have the ability to go in and to do over 300 patients a day. You know, that's a really, really big deal. So we're proud of what the Division of Emergency Management's been able to do. We had been talking with hospital CEOs. We did a roundtable a few weeks ago. They were talking about the positive effects of this. They also told me that some of the patients being admitted didn't know about it or weren't seeking it. And so then we did a public event at Tampa General to talk about the success they've had. And then we said, you know what, let's just expand this, because if we can end up doing some of these treatments through these sites, that's going to take pressure off the hospital admissions. And I know the hospitals are doing this as well. They've obviously been dealing with a lot this summer, so wouldn't that make sense? And I think we've gotten a great response, and so we're going to continue to do it. So I want to thank DEM for what they've done. And again, this will be 7 days a week here at CB Smith Park. There'll be an announcement in Miami. There'll be one Tropicana opening later this week. And that will be something I think that will be very beneficial. And the Miami hospitals have done a good job of applying this treatment as well. This supplements those efforts, which we're happy to do. Okay, so we're going to hear from Kevin, and then we'll hear from Ken.
Well, Governor, once again, thank you for your leadership on this. What is the Florida Division of Emergency Management doing? We are working with local city and county emergency management agencies to identify low or no-cost solutions to bring contract staff in to apply the monoclonal antibody. So that's what the Florida Division of Emergency Management is doing, and we're bridging that gap, making sure that we can keep low, no-cost solutions on the table. So again, we want to thank Broward County, we want to thank the city of Pembroke Pines for letting us be here. We're trying to do these in neutral locations so that many hospitals can be serviced by one location. The other thing that I would just want to mention is, again, the governor just said you don't necessarily have to have a referral here. PatientPortalFL.com is where people in this community and across the state can go and register to get an appointment to come here to this facility or any of our other 15 to 20 facilities and get the much-needed Regeneron that they need. Again, PatientPortalFL.com. Again, Governor, thank you very much for your leadership on this.
Okay, Doctor.
Thank you, Governor. I just want to quickly share a story. As the Governor mentioned, we're starting to get a number of stories of success in this program. I really thank the Governor for really expanding this life-saving therapy. So we had a gentleman, 98 years old, a really fascinating guy, I'm really admiring of him. 98 years old, served in World War II. His family tells me he worked on the Doolittle airplane, he worked with the Tuskegee Airmen, did everything right, got fully vaccinated, but unfortunately, he had to get hip surgery. And after hip surgery, he was in getting rehab, and unfortunately came down with COVID. Now his family is really well informed, and they learned about this monoclonal antibody therapy that can help save their dad, but they were having trouble getting it. They had trouble because he had surgery, it's hard to move him, transport's an issue, so they reached out to the governor's office. Within 24 hours, we were able to get, thanks to the governor, one of these strike teams to him, treated him with this life-saving therapy, and at that same facility, treated several other folks with this life-saving therapy. So I just want to briefly talk about vaccines and monoclonal antibody, clear up some of the misconceptions out there. The vaccines are preventative. They're clearly one of the best tools we have in medicine to give you long-term protection against severe illness and death from COVID. And the vaccine's been widely available for all eligible flu readients, for anyone who's wanted for months now. And if you're not already vaccinated, certainly I encourage you to go get the vaccine to get that prevention. But once you become sick, either because you're not vaccinated and get sick, or because, like this gentleman, you're elderly and the vaccine's starting to wear off on you, you get sick, we need treatment now. Not just prevention, treatment. And that's where the monoclonal antibodies come in. So we want both. We want the vaccines to prevent you from getting severe illness, but if you get sick, we want the monoclonal antibodies to keep you from getting really sick, dying, or ending up in our hospital. Thank you very much.
And also, to point out, so there was the Eli Lilly that was also approved. We're doing Regeneron. The Regeneron is found to be effective against Delta, the Lilly not so much, and so I think most physicians with Delta being the dominant strain are going to be recommending the Regeneron, and so that's what we're bringing down. I also just want to say that so much of what goes on, well, with almost everything, but certainly with COVID, there's always people trying to push political agendas, partisan narratives, regardless of facts, trying to gaslight people, trying to pursue their own interests, even if it's not going to be helpful for people, even if it may dissuade someone from seeking a life-saving treatment. And this is no place for those phony narratives, for political posturing, or for partisanship. This has been available for a long time. It's a widely recognized treatment for people that have early-stage COVID-19. Again, the state of Florida isn't paying for this. The patients aren't paying for this. This is something that the federal government bought out very early on, and it's available and it's effective. It's not mutually exclusive for doing other things. The fact of the matter is, if you have high prevalence and you have people who are coming down with COVID, what are their options? And this early treatment is the best option. And even a lot of people, who are trying to, play politics with this have previously acknowledged that this is something that's very effective. So let's just get real here, and let's be honest about facts, and let's not try to pursue partisan agendas that may have the effect of dissuading somebody from seeking a treatment that could potentially not only keep them out of the hospital, but could actually save their lives. With that, I'll take a couple questions.
Governor, there are a lot of school districts that are coming down with decisions today, reconsidering their position on mask mandate. Yesterday, the state board of education basically said that they are rendered pretty much toothless because of some of the measures that President Biden has announced.
I don't think that's what they said. I think you're mischaracterizing that. I don't agree at all. They enumerated some things that would be very appropriate. And here's the thing: the forcing young kids to wear masks all day, these kindergartners, having the government to force that, that's not defying me. That's defying the state of Florida's laws and the Parents' Bill of Rights that was enacted just this past legislative session that I signed into law. That was the legislature of Florida that said the parents are the ones that have ultimate responsibility for health, education, and welfare. And so this is not just something we're making up. This is what the state law says. These emergency orders implement the law that the legislature passed. And I can tell you, I know that there's a lot of members of the legislature who say, wait a minute, you're just above the law? You think you can do whatever you want? That's not the way it is. So the legislature has spoken. I've signed it into law. Parents obviously are in the driver's seat here, and that's what the law is. There will obviously be consequences, I think, in probably a number of different ways. And at the end of the day, you have local officials who do not believe they need to follow the law. That's what this is about. It's not about, they're trying to posture it about me, because if you make it about me, you get on CNN. We know that, right? Or you get some of the other media outlets. They'll like you if you do that. We know that. That's just how the game is played. But that's not really what it's about. It's about the people of Florida, through their legislature, have said parents have certain rights. And I can tell you this, a parent has the right to send their kid to school the way that's most healthy for their child. And to have a 5-year-old or a 6-year-old forced to do this, again, Britain doesn't have kids en masse. In fact, during their Delta wave, they didn't have the school kids en masse. European countries overwhelmingly have rejected that. In Florida, we had 35 to 40% of our school districts last year did not require this. We had charter schools, private schools. Elsewhere in the United States, you don't see a difference statistically significance in outcome on that. So therefore, it's really up to the parent, and that's not because I say so, that's because that's what Florida law commands. Yes, ma'am.
Talk about the change in reporting of enrollment numbers. I know you changed the method last week. It's very inconsistent. Is there any attempt to rectify that?
I'm not sure what you're talking about, so you'd have to give me some more clarification. Yes, sir.
Governor, Regeneron definitely effective against COVID-19, like you said, helping to prevent progression to your disease. You've been out in the state promoting it. Have you done enough to promote vaccination?
Well, you tell me. I mean, how many events I did? I've done over 50 public events. I was in Broward as soon as we got the Pfizer, we were the first state in the nursing homes. I literally wheeled one of the seniors out after having done it. We brought vaccines and were criticized for doing it to places like Century Village in Broward, Kings Point and Delray Beach. We were bringing it directly into senior communities. We brought it into retail pharmacies and were criticized for making it easier for people to be able to get the vaccination. So I would encourage you to go rewind the tape and watch what had happened over those times and how relentless we were about saying seniors first. Everybody's going to be able to get it. And sure enough, as Dr. Shefke said, since April, every single adult Floridian has had easy access to this. This has been distributed far and wide. You've been able to do it. But as Dr. Shefke said, it's not an either or. But if you're facing infection, which many Floridians have with this Delta wave, then what do you do? And I think the data is very clear. The vaccines are helping to prevent severe illness amongst people who do it. But once you're infected, the vaccine is not going to treat the infection. And so what do you need to do to be able to do that? So it's obviously both. But when you look at having almost 4 million seniors vaccinated, and we're number one in the Southeast in our region, and we're ahead of the national average on that, we're not doing mandates because, quite frankly, I don't know individuals' health. It's their decision. And I remember going to that when we went to the first nursing home. We went there, and it was very emotional for a lot of the residents because they had had a rough 9 months with how fragile nursing homes were, and obviously the residents were very high risk. You had some that were crying, and they were so happy, but you know what? There were some residents who just did not want to take it. And so who am I to say an 85-year-old, I don't know their health conditions, I don't know what's bringing them that. They may have had a prior COVID infection. And so there was never a desire to mandate this on anybody. But I can tell you this, vaccinated or not, if you come down with this, we want to make sure you have an opportunity to go get treated. We want you to be able to neutralize the infection. And I can tell you, clinically the data is strong, and then what we've seen in Florida has been really strong. And my thing is like, okay, put the politics aside, recognize what, I think almost every physician has said this is positive if you're taking it appropriately. Even the Biden administration, they're all in on this. They've been promoting it. You don't see the same type of little, games being played in terms of them, but I could do the same thing if you wanted to do that. But that's just what happens. That's just the world we live in. So that's been the case. So let's get this done, because the number of people who've been admitted to hospitals would have been dramatically less if they had known that this was something they should have solved early. Look, some of it's just human nature. You get infected, maybe you feel okay, maybe not that bad, modest symptoms. You kind of hope, well, I'm not going to get that sick, right? And maybe that's the case. But if you're in one of these high-risk groups, just know that you have the ability to bring some serious ammunition to the fight here with these antibodies, and especially those folks in those high-risk categories. They're the ones that are less likely to produce the right immune response. And so this is providing, really, it's turbocharging their immune system and the antibodies that are able to respond. So it's been very, very effective. Now more and more people know about it, and I just hope that the message is put out very, very clearly and accurately. This is free to every Floridian who qualifies and wants to avail themselves of it. It's free to the state of Florida. That's just the reality, and it's something that, if done early, will absolutely stand a great chance of keeping you out of the hospital. It also can be used, incidentally, not just to treat a COVID infection, but actually it's been approved for emergency use for vulnerable people to use as a prophylaxis. So, for example, if you have an infection at a nursing home, you can then have, our teams can go in and they can provide the treatment to the nursing home residents even if they have not tested positive. And so it's being both in terms of the additional treatment but also as a prophylaxis. It's approved for both of those things, and I think that that's very important. So what you're going to see what you're seeing now with the nursing home strike teams, there's an issue in the nursing homes. We have been able to go in and we're able to give this and offer this to folks. And again, this will be, our vulnerable population is overwhelmingly vaccinated, and you're still seeing positive cases. And so it will be applied either way, regardless of that status, and particularly if you're in a vulnerable category. So they will be going into nursing homes. They'll be able to offer this. You can do it both IV, but you can also do sub-Q, which is much quicker and allows you to do more. You go in a nursing home and knock that out very quick if you're doing the sub-Q. Only Regeneron is approved for sub-Q application. The other ones all require only IV. Regeneron, you could do IV or you could do sub-Q, which makes it much more versatile in doing. So you're going to see us going into there, and you're also going to see, you may see up to 20 sites, by the end of this week. And I think it's going to make a big difference. What I can say is this: if you're in these high-risk groups and you're following, and as soon as you develop symptoms, if you come do this, you will absolutely see over the next couple of weeks a decline in hospital admissions. And at the end of the day, if somebody gets infected and they have a mild illness for a day or two and they recover, we'd much rather see that than obviously see them hospitalized. And I think this is really one of the keys, not the only key, because there's so many more things to be able to do. But at the end of the day, when you have a lot of infections, this is something where people need to turn to. Okay, thanks so much. We'll see you guys soon.